Dr. David Nielsen has developed a revolutionary procedure to relieve and even eliminate hyperhidrosis. Micro ETS is offered exclusively by Dr. David Nielsen to treat hyperhidrosis symptoms. Dr. Nielsen is a board-certified thoracic surgeon and has performed over 6,000 procedures with his micro ETS technique.
You know, we all to relieve after a good workout, but what if you perspired excessively all the time? Well, it can be embarrassing. It can interfere with your social life. Medical reporter Angela Veerville says this medical condition begins in childhood, and a local doctor may have the answer.
Dr. David Nielsen has been chosen to carry the Olympic torch. That's because of his work curing patients with this disorder, where they constantly sweat or blush. With this breakthrough procedure, patients go home from the hospital within hours instead of days.
They suffer from a condition called hyperhidrosis, and for many it means sweaty hands, sweaty feet, and sometimes even their face 24/7. But now there's a new procedure that will cure it. And tonight we follow one of our very own Fox co-workers as he goes under the knife.
Is about to undergo a microendoscopic thoracic sympathectomy, or micro ETS, a unique treatment developed by San Antonio surgeon Dr. David Nielsen. It's for patients with hyperhidrosis, excessive sweating, a condition which troubles millions and usually begins in early childhood.
Here's the procedure. Through 2 tiny incisions, the doctor places a little scope up to the spine, to the nerve that runs along the spine. The surgeon then divides that nerve.
Until now, cutting the sympathetic nerve required major surgery, but Dr. Nielsen uses a laparoscope containing a tiny camera. Within minutes, he spots the nerve, cuts, and cauterizes it.
And through that single incision per side, I work, and I'm able, behind the lung, without deflating the lung, which in and of itself is kind of tricky, but anyway, then to divide the sympathetic nerve precisely where it crosses the, in most cases, the second rib.
Then the signal from the brain sweat stops.
I go in through a very tiny incision, it's about that big, and I make the incision in the underarm area, right just beneath the pectoralis muscle here, right back in here, and then I use a little bit of carbon dioxide to push the lung off the nerve enough to see it.
The nerve Dr. Nielsen is referring to is this one. You can see it here. It's called the sympathetic nerve, and it's the culprit causing all the wetness. You're able to see the nerve through a specialized camera Dr. Nielsen calls an endoscope.
I insert through that single incision this little scope, and it projects on a big television, about this big, a big monitor, the picture, or in other words, the area of interest. In this case, it's the ribs and the sympathetic nerve crossing the ribs. And then I have a little micro scissor that I use to precisely divide the sympathetic nerve at the upper border of the second rib.
By slicing the nerve, Raul's hands and feet will dry up in less than a day, something that still astonishes most patients.
It's unbelievable that something could make that much of a difference to where their hands are dry and warm. And they're just beyond just even imagination that could actually happen.
I can hold friends' hands and I can write better, and I won't have to rub my hands on my clothes or anything.
I can go up and shake somebody's hand, and I think it's just a miracle, I think.
It's changed our lives so much, because she can do all the things that she's wanted to do and not be shy.
Basketball coach Becky is living proof it works.
My hands have not sweat now for a year. It's absolutely amazing.
Go out and meet people. Yeah, go out and shake some hands.
The whole thing can take under 20 minutes.
Usually within 1 to 2 hours after that, feels well enough to be discharged.
Patients of all ages come to San Antonio from around the world for Dr. Nielsen's revolutionary procedure. It usually changes their lives.